Active cervical range of motion of the spine. For active cervical flexion, I ask the client to get their chin to their chest, and for extension for them to tip their head back as far as possible. Testing active range of motion gives us as practitioners an indication as to how far the client feels comfortable to move at the joint, and it may highlight any pain that the movement causes. Next is testing active cervical lateral flexion of the spine. For this, I ask them to get their ear to touch their shoulder and to do this without raising their shoulder. I get them to repeat this on both the left and right hand side, as this allows us to compare each side to the other to identify any abnormalities or differences between them. This is active cervical rotation of the spine. I ask the client to bring their chin over to above their shoulder, away from the midline of the body, and I ask them to repeat this on both sides. It is also important that they keep their shoulders facing forward so that they are not aided by thoracic or lumbar rotation, which would allow them to rotate further. Here I am testing passive flexion and extension of the cervical spine. For this, the client needs to fully relax and give me the full weight of their head so I can manipulate their movement. Testing passive range of movement allows me to assess the end feel of the joint, which should be quite firm at the cervical spine. Testing passive range of movement at the cervical spine but for lateral flexion. I reposition their head towards either shoulder, ensuring that their head does not rotate, flex or extend. I take the head back to neutral after assessing both sides, allowing me to see and feel the motion in both directions of the movement. Here is passive rotation of the cervical spine. I rotate their head to both the left and the right while supporting the underside of the head, taking it from one side to the other through its whole range of motion. Passive range of movement allows for examination of how the joint, the capsule, the cartilage, ligaments, tendons and neural tissues are working during the movement, without the interference of active interaction of the muscles. Now I move on to the thoracic range of movement T1 to 12. Here is the test for active thoracic flexion and extension. For both movements, I ask them to cross their arms over the chest. For flexion, I ask the client to round their back and curl their upper torso, and for extension to try and push their sternum towards the ceiling. Here is another method of testing active thoracic extension. I ask them to pull their sternum up to the sky again, but this time with their arms behind their head. This more specifically targets T1 to T4. This is testing active thoracic rotation of the spine. For this, I ask them to cross their arms over their chest and reach their shoulder to the wall behind. I then ask them to repeat this on the other side. This is done on both sides so that each can be measured and values can be used to compare, which may help identify specific areas of the spine which are causing the problem. As well as this, these measurements can be used as a means of tracking recovery or improvements in flexibility. This is active testing of lateral flexion of the thoracic spine. I ask the client to move their shoulder down towards the couch and then repeat the same thing on the other side. For this movement, it is important that their hips remain facing forward and that their bum remains flat on the bed so their mobility is not being aided. This movement is performed sat down so that the thoracic spine is isolated from the lumbar spine. Active flexion of the lumbar spine L1 to 5. The client moves their hands down their legs as far as they possibly can. This movement does target the lumbar spine, however the range of mobility that the client has may be limited by hamstring flexibility. If this is the case, then asking them to do it with slightly bent knees will help the focus to be on the spine. For active lumbar spine extension, I ask them to place their hands on their back with their palms facing outwards and bend back towards the wall as far as they possibly can. It is important to ensure that their legs remain straight, their feet are flat on the ground, and that their hips do not extend forward too much. Active rotation of the lumbar spine. I ask them to cross their arms over their chest and pull their shoulders back towards the wall. They must keep their hips facing forward so they are not aided by hip rotation, and keep their shoulders at a level height so lumbar extension is not in use. If other elements are being used in the movement being tested, then it can give an inaccurate assessment of how much mobility there actually is at the joint, leading to issues in recognising joint problems and tracking recovery. Finally is testing for active lateral flexion of the lumbar spine. I ask the client to have their arms down by their sides and run their hand as far down their leg as they can without bending their knees. It is important to ensure that no flexion of the lumbar spine occurs, which could increase how far down the leg they can reach. The range of movement should be measured on each side and compared to identify differences and abnormalities between them.